Hey, I'm Hazel, and this is my level 3 seated yoga and movement. If you haven't done levels 1 and 2, I would recommend doing that first. These are progressing to, they're still very basic movements for beginners. But if you're not sure if it's for you, then obviously please do check in with a GP first. Ideally, you'd find a bit of space for this. A dining room chair is ideal that has arms that we can use for support. And if at any point it doesn't feel good, then please stop and feel into your body. So you may have particular injuries and pain. So these types of seated exercises are good for those that have been quite sedentary for a while. If you have chronic pain or chronic illness, then these are good for you to try. But as I said, please start with the level 1, 2, and then progress to this video. So let's get ourselves in a good position. So ideally you'd have your feet rooted on the ground or under a cushion. If it's difficult to sit upright without support, then make sure you have some cushions behind you. And let's allow ourselves to land first. So encouraging you to look down, soften your gaze or close your eyes. And just notice how you are. So see if you can notice if you have lots of thoughts, if you have a busy brain, very common. Can you notice how your body feels? Then you notice where you can feel the chair and your cushion. You may be able to feel the air on your skin. See if you can notice the sounds that are around you. Now see if you can notice what you can see, and that might be your closed eyelids. Are there any shapes or colours? And gently take your attention to your breath. Can you notice that you're breathing? And if they're not already, opening your eyes. Starting off with some gentle movement. We'll be taking some movement into the shoulders. And it might be that you feel happy to get the elbows involved. You might be stretching out your jaw at the same time. And then if you've got happy shoulders, see if you want to reach and stretch your arms up. And imagine you're reaching up to the sky. So reach up with one arm and then reach up with the other. Should give you a stretch all down your side. Reaching up. 2 more. Let's have one each side. Great. Letting the arms come down. And then take your arms out wide and open your chest in a seated cat-cow. And then round and take your hands to touch. So I'm opening, I'm lifting the chest. There's a little lift of my chin maybe. And then as I round, taking the hands down, taking the head down. If you can coordinate the breath, this is an inhale as we open. And this is an exhale as we come down. If that's too complicated, do not worry about the breath. Opening, lifting, breathing out, coming down. Let's do one more. Lovely. Come back to center. Picking up a leg, it doesn't matter which one, and cross it over. So cross it over the other foot. Taking your hand onto that knee and gently rotate the opposite way. So your foot will be going off one way and you'll be turning the other way. Come back to center. Swap over to the other side. Doesn't matter if you're going a different way to me. And rotate. Use that knee as a bit of a lever. Coming back to the center. uncrossing. We're going to do a little bit of strength for the lower body. If it's helpful, you can have your hands holding on to the arm supports. If it feels a little weak, you can also have the hands helping the leg, but I'll show you the movement. So you'll be extending and lifting your right leg, bringing the knee up and taking it down. We'll swap each time. So I'm extending my left leg, and I'm bending the knee up and I'm taking it down. So if that feels a bit tricky, you can always hold on to the leg to help you, and you can use a bit of your arm strength to help it. Don't worry if your leg doesn't completely straighten, it might partly straighten. Don't worry, see how far the knee comes up. So either doing it with just the strength in the leg or using your arms to help you. Last one. Lifting up. Good, take it back down. Now taking your hands back to those arm supports. We've been building this one up during the levels. So this time we'll be pressing down, as long as your wrists feel happy. We're going to try and pull the belly in slightly. And maybe this time the bum will come off the ground. So you're pressing down, pushing down, rooting your feet down. And it might be that you can just lift up slightly and then come back down. So I press down, pull in my belly, I push down with my feet, and I lift just an inch off the seat and back down. That's too much. You don't have to come that high. You just stay lower, or that feeling of coming off the seat. Pushing down, lifting, back down. Let's do one more. Push down, lift, and back down. Lovely. Coming up to standing. You can go behind your chair. I'll just rotate mine to make it easier for you to see me. And we're going to progress our balance this time. So I'm holding on a good stable support, however much you need to hold. So if your chair isn't stable enough, hold on somewhere else. And we're going to be lifting up our right leg. So try and keep yourself nice and upright. We're lifting up this leg. And then we're seeing if we can take the leg forwards. And can we take that knee slightly out to the side? Take it back and touch it down. So we're working on our balance and we're doing some hip movements. So I'm bringing the leg up, out to the side, back to the front and down. You might find you can hold on slightly less with the hands, but not so much that you feel wobbly like you might fall over. But a little bit of wobbling is good to build up your balance. Let's do one more. I'm lifting up and taking it out to the side. And don't worry if your leg doesn't go quite as far out to the side, that's okay. A little shake. And let's swap over. So we're lifting our left leg, and this time the knee comes in front of us, catching our balance, keeping our core strong. Knee comes out to the side, back to the front, and then take it down. Lifting up, side, back, and down. Got two more. Up, out, and down. Last one. Great. Give that another little shake. Now take your feet nice and wide, so I want you to have a really good stable base. And you're holding on really strong to the back of your chair, or you might be leaning on your kitchen counter. Gentle drawing of your belly, soft knees, and I just want you to very gently lean forward slightly and then come back upright. Only go as far forward as you feel happy. If it feels like your chair might slide a bit, then maybe find a more stable base. Kitchen counter is ideal for this. So you can always pause the video and do these on the kitchen counter. I don't want your chair moving too much. So I'm just leaning forwards. You feel this in the pec muscles and in your arms. Let's do one more. Well done. Let the hands come off, give them a little shake. And we'll finish our routine here. We're coming back to some squats. So I've got my feet nice and wide in a stable base. And I'm going to bend my knees. And I'm very gently going to lean to the right side. I'm leaning to the left side. I'm coming back to center, then I'm coming back up. So let's try that. We're bending, squatting, going to the side, going to the other side, to the middle, back up. Really keeping a stable base. Don't need to go very low. Little bend to the side, to the other side, back to the center, back up. Well done. Find your way back into your seated position on your chair. Softening your gaze or closing your eyes. And take your awareness inwards. Notice how you are. Notice if those movements have affected anything, have changed. Maybe the body feels a little bit more alive. Notice what you can see, either looking down or behind your closed eyelids. Can you notice your breath and the air coming in and out with your breathing? And finding your way back. Well done. As ever, see how you get on. These are designed to be done daily. So the idea is that you get into a routine. You try and build some discipline. So maybe having a routine where you do it at the same time each day can really help. As ever, if you have any questions, then please do get in touch. Take care.